who works in hospitals, what's the most insane thing you've seen? Story 1, I have a couple that stick out. First one I did not witness, but was told about. Guy tried to kill himself by walking into a samurai sword. Wheeled into the, or with the sword still in and still alive. He survived. Woman came in with an entire glass candle in her. She specifically asked for it back after having to have it surgically removed. Another gal with a bottle of fingernail polish in her. Her wanted to try, and apparently a nail polish bottle was all they could think of find to loosen things up. You know those little gardening shovels with the foam handles? One of those handles in a man's. He claimed his wife did it to him to test if he was gay. A writing pen lodged into a 20-something-year-old's urethra. He tried telling the doctor that he had swallowed it, and it got stuck leaving his body. The doctor assured him that he was very well educated on the human body, and that is not exactly how the body works, nor how it got there. LMAO, a woman having a toe amputation. She was diabetic and let a sore get out of hand. When they first unwrapped her foot, you could see the tendons on half of the top of her foot. I then witnessed the doctor grab her pinky toe with what we call a penetrator towel clamp, and he just tugged it off, not even forcefully. It was so rotted that it just slid off her foot like butter. And last but not least, this poor elder gentleman who had flesh-eating bacteria around his entire anus and had been fighting it for a good year. There was so much scar tissue what was rotting away. Also, fun fact, when men have laparoscopic surgery, the gas that fills the abdomen travels to the testicles. They blow up bigger than a softball. We have to squeeze as much air out as possible before pulling them out of anesthesia. Story 2, not the most insane, but certain very shocking. A young man less than 25 tried to off himself with a shotgun blast under his chin after his GF died of cancer. He did not succeed, but what he lost was his jaw, his nose, his eyes, and part of his frontal lobe. I'm a physical therapist and was sent in to evaluate his discharge disposition. All his notes said was GSW to head. It did not specify the damages. He had no face. It was just raw meat and exposed bone. They couldn't really dress it because it would get in the way of his breathing. He had something like 14 reconstruction surgeries planned. He lost his POA, and his mom pushed for all of his rehab and care. Story 3, guy went into his neighbor's garage and used a saw to cut his own leg off. He was with us for a couple weeks. I asked him, why would you do that? Soon after admission, he simply stated, you can cut your hair or nails. Why can't I cut my leg off? Well, can't argue with that logic. It wasn't until a few weeks later he was working with therapy and trying to manage transfers and daily living tasks that he came to the realization, yeah, maybe I shouldn't have done that. Story 4, one of funniest, was patient on Halcyon Sleeper, now off the market thought. He was a bear and roamed the halls naked, growling and pooping his bowel prep. He was captured in a female patient closet. He suffered no injuries and didn't remember a thing. One of many stories from the night shift. Story 5, this was 15 years ago, but did you know that using a shop vac to off what can rip the skin from AK deglovure? That patient certainly learned it that day. Story 6, define insane. Critical care doctor here. Insane, a late 20-year-old woman of about 35 kg, 120 cm size, that's 77 lbs, 4 feet, with multiple congenital abnormalities, resulting in an inability to eat, talk, read, or understand, who had been that way since birth. She required total care for every bodily function and had for her entire life. She was in and out of the hospital monthly due to what was essentially unfixable body failure. Each time we had to jam tubes in her, put her on various forms of life support, and repeatedly subject her to painful procedures while knowing all along that we could not and would not ever fix her in any kind of meaningful way. She was neurologically gone. Yet her mother insisted she responded to her and expressed her feelings, insisting that we do everything. Ultimately, we had to put this poor soul through the pointlessness of prolonged CPR before she finally died. That was insane and cruel. Story 7, what nurses are expected to accomplish in a 12-hour shift. It's complete BS how the nursing staff is pilled on. What used to take twice the nurses to accomplish. Welcome to America, where nobody cares as long as insurance companies are making money. Story 8, had an admission on the medical floor. A man had been found at his home, lying on the floor. Apparently, he had suffered from a CVA, a stroke, and had been on the floor for quite some time. The gentleman lived alone in a small house without neighbors nearby. He was eventually found, I am unsure by who and how, and brought to the ED. Upon his ED visit, he was found to have developed decubitized bed sores to one of his hips and upper arm from where he had lain on the floor. There were maggots in the bed sores. Story 9, 20-year-old put his sport bike into guardrails at high speed, arrived alive, and ultimately survived with left arm, left leg, and right leg completely severed from his body. Just formalized all 3 amputations and surgery for hemostasis and skin coverage. Runner-up was a girl in her 30s with a locking blade knife, stabbed through the left temple all the way to the hilt, with the blade crossing through her sinuses to the other side of her face. She was completely fine, and we removed the knife with no significant problems resulting. Story 10, I'm a hospice volunteer, and I visit a patient in a facility that is mostly old people on Medicare. The other day, the census was 85. There were 10 employees total. Only 5 of them were nurses. It is like a vision of... Story 11, it was 11 to 7 p.m. critical care supervisor in a 400-bed community hospital in Texas. Around 1981 or so, we had a rush admission from the oncology floor. A middle-aged lady with ovarian cancer and metastases started a vaginal hemorrhage. The ER physician on call for codes ordered her transferred while I tried to get a hold of her surgeon. He wouldn't return calls or attend the patient. I got orders from the ER doc for heavy pain medication and called the chief of surgery, who was there in 30 minutes. The RNs and aides were carrying basins of blood out of the room. Thankfully, she passed relatively peacefully. The surgeon was thrown off the staff when more neglect and poor treatment was revealed. Story 12 went there with a loved one on psych hold, so they had subtle security on us all the time. Until, that is, the guy came in who they had to pull out of a tree because he thought he was a monkey and was throwing his own at the police. Suddenly, security had bigger problems. Story 13, I've got a plethora to choose from, but either labial necrotizing fasciitis on a 600-pound woman or tracheostomy maggots. We also had a recurrent patient Hood get 1L glass bottles of fauna stuck in his. And since I know someone will ask, they were always grape. Story 14, I don't work in a hospital, but I have the utmost respect for an ER nurse on duty when I had to take a classmate to the ER in college. It's 11 p.m. on a Thursday, and it's quiet. The phone rings, and the nurse answers. I only heard her side of the conversation. In hospital, and I'm sorry. What about tennis and a tennis ball machine? What about the machine? Northwell, how close to it were you when the ball came out? And it hit you in the face. And yes, you should have a doctor look at that. Do you need an ambulance? And well, are any of your friends sober? You should not be driving after drinking, and with a potential head injury, and no, putting your beer in the cup holder isn't going to be enough. You either need to tell me where you are so I can send an ambulance, or you need a sober person to drive, and I'm sure you are very good at driving left-handed. But that doesn't mean it's okay to drive with a beer in your right hand, and okay, sir. If you still need help, please call 911 at this point. The caller hangs up. The nurse calmly puts down the phone, checks that there aren't too many people around, and cracks up laughing. Apparently, the guy thought the tennis ball launcher was broken, so he went up and looked down to launching mechanism, and a ball was launched directly into his eye. Definitely not a sober situation. By the time my classmate was admitted and moved upstairs, there was a pool going on when if the guy would show up. I still wonder about that guy sometimes. Story 15, my co-resident intern year, had an elderly man brought in by EMS for rapidly progressive bilateral leg weakness. The patient was the kind of person who hadn't seen a doctor in decades. CT scan showed total occlusion of his abdominal aorta. The entire lower half of his body was dying. It was presumed he had an advanced malignancy that contributed to the hypercoagulable state, but by then the cause didn't matter. Too much of his body hadn't been perfused properly for too long. The patient was calm throughout, seemed at peace with his impending death. He never even made it up to the floor, died in the ER. Fortunately, they had called his son, who made it to the hospital to be with Dad when he passed. I didn't even know total occlusion of the abdominal aorta was possible. The fact the guy had been walking until very recently and only called 911 because he couldn't walk anymore really blew my mind. The human body is crazy. Story 16, my wife is a nurse and used to work in an ER close to a major city. They had a lot of mental patients come through all the time. Usually these patients have someone who sits at their door and keeps an eye on them. The person fell asleep, so the patient tried to escape by climbing into the ceiling tiles. He made it further than you would think, and the security guard waited until the guy was right above him, punched his hand through a tile, grabbed the guy's ankle, and pulled him down through the ceiling. I always thought that sounded like something in a movie. Story 17, my sister is a nurse, and she told me one of the worst things she saw was a woman who came in with an extreme case of warts, like so massive that my sister couldn't even talk about it. I didn't ask for elaboration. Story 18, I was a radiology assistant and handled a lot of images. Our office was remote, and we pulled and read for several dozen hospitals. A fellow nicknamed Jesus, he took an 80 swan dive off of a bridge on a railroad tracks. He was amazingly still conscious when they brought him in, and he was talking to everyone, flirting with the nurses, and acting like he just woke up and was waiting on a cup of coffee. He broke dozens of bones but had no other major trauma. Not even a concussion, piercings, lots and lots of piercings. They show up on x-rays. Real weird when you see the name of someone you know pop up and see that, oh, they have a half pound of rings in there or penis. Child abuse. The worst was when you would see an image and know that this kid had been broken and beaten before because they had healed the old wounds. I spent more than one shift talking down an ER doctor so they could do their job when a child came in absolutely destroyed by their parents or caregivers. Story 19 tie between 1,000 bee stingers in a person, a whole cucumber in the abdominal cavity of CT scan, a patient who ripped his eyeball from a socket, and 3 liters of pus drained from a lung cavity. Not the same patient, but still. Story 28 patient came in because his toe looked funny. As a diabetic, my alarm bells were going off, so I had him take his show and sock off. He looked down at his 4 toes and exclaimed, "Where did it go?" Moral of the story: patient takes their own clothes off. Story 21, one of my friends works in the state hospital where I live. There's a guy in there that suffocated his great-grandmother to death for throwing out his cigarettes. They used to keep them in a private hospital, but he was too hard to handle, so they threw him out. Story 22 from a previous answer to a similar question many years ago when I was in my residence. A man entered ER with a hand to his forehead, walking by himself, asking for a doctor. You can imagine my surprise when I said yes. To him removing his hand and showing his injury, a perforating hole from a bullet. He was quickly moved to surgery after that. Later, I found the bullet didn't reach the brain. It was well buried into the skull bone. Story 23, I once had an encounter with a Nazi Santa Claus. I was looking over the lobby of the hospital when I saw a man getting wheeled in by the transport crew. He was heavy, probably 300 pounds, and a thick, snowy white beard. My immediate thought was, oh no, Santa Claus is going into hospice care. And I chuckled at myself for having seen Santa's entrance. A few days later, I get called up to draw blood on a patient. Lo and behold, it's Santa needing a transfusion. I lift the sheets from his arms, and holy, that's a lot of Aryan Nation tattoos and a few swastikas. My only thought was, well, that certainly explains why Jewish kids don't get any presents. Story 24, a patient who was 11 but acting okay suddenly ran out of his room and punched the back of a new NP's head, knocking her to the ground. She was young and in training, and her whole career was ruined due to the health complications from it. Another is in 4 drug user taking off within 4 port when we noticed he was missing. Security saw footage of him walking off the campus 20 minutes prior. Story 25 didn't see this, but was told this by a reliable source. A lady came into the ER convinced she was pregnant. Her belly was super swollen, and she said she felt the baby trying to move into her vagina. She had an ultrasound, and there was no baby. But there was a massive lump that turned out to be a 5-pound SHD that was pressing into her vaginal canal. They actually waited after it was removed. Story 26, I have taken care of more than one person over the age of 90 years old who tried to end their own life due to inability to cope with pain anymore. Extremely sad, but also understandable. Lowest hemoglobin I ever saw was 3. 5 normal was above 12 at least. Person was walking, talking. And absolutely floors me every time I see it. But fungating breast wounds. One that smelled so necrotic that you could smell it down the hall and several rooms away. I was able to put most of my index finger in a breast wound, and the patient could not feel anything. Story 27, 3-year-old twins came into the PEDS ER, both dead on arrival from a vehicle rollover accident. Their parents were care flighted to another hospital in critical condition. It was the twins' birthday, and the parents were taking them out to their birthday party. I still tear up thinking about that case. I never learned what happened to the parents. Story 28, therapeutic leech decided to make a run for freedom and somehow escaped the ICU room and made it across the hall before the nurse realized, left a trail of blood all the way from the bedside out into and across the hallway. Most disturbing, though, was probably a woman in the trauma ICU after sustaining a traumatic brain injury when a tree fell onto her car while she was driving. The tree killed her teenage son, who was the passenger in her car. The TBI had severely impaired her short-term memory, which meant she kept waking up on the ICU, panicking, asking how her son was doing, and demanding to see him. So several times a day this woman would learn anew that her son was dead. We had to ask the hospital ethics department if we should keep telling her he was dead. She was very insistent on seeing him if she was told he was alive and force her to relive that pain over and over or lie to her repeatedly. It was horrendous. Story 29, don't work in a hospital, but I was an EMT, saw a girl and her boyfriend wreck a motorcycle on the highway. No helmets, her arm was completely twisted on her back. We had to break it again to move it back in position. I felt so bad for her. She got plenty of drugs and a helicopter ride though, so she wasn't in pain for long, thankfully. Story 30, do mental hospitals count? I was a patient in a mental wing of hospital. Long story. I was there for 9 days, and I was literally the only sane person there. Anyway, 3 things I saw while I was there. The first was my roommate. He was around my age and relatively cognitive, but lacked common sense and seemed to have the capacity of a 6-year-old. In our room was a huge floor-to-ceiling cubby with 3 slots. He'd climb to the top cubby and belly flop himself onto his bed, a solid 9 feet or so, very similar to the kid from Big Mama House. The second was a Caucasian woman who was there because she jumped through a glass window. Her head was shaved bald, and she had stitch and staples all over her scalp. She was hissing and trying to bite at the techs. She was also yelling out Miller. Lastly was a 700-pound woman who covered herself in some sort of shiny liquid, what I assumed to be soap, because we were not allowed much. It was the middle of the night, and I heard the techs on the ward call some sort of code. I peeked out my door and saw said woman, naked as the day she was born, oiled up, and slithering down the hall like a worm. Story 31, my old roommate, was an ER trauma nurse and had a patient who was in a motorcycle accident, was not going to survive, that basically ripped his skin ribcage completely off. One of the nurses took a video of the heart beating in his chest. Still, I will never unsee that. Story 32, do you have beer? I have stories. GF1 caught a guy with GF2. In the ensuing argument, he handed GF1 a sawed-off .22 rifle and said, "If you feel that way, shoot me." So she did. One shot pierced his stomach, severed his superior mesenteric, cut through the aorta, and was lodged in his spinal canal without severing the cord. We had mesh trousers back then, and one of our ER nurses was moonlighting as an EMT. He got his partner putting on and blowing up the mast. Mike put in 2 large-bore lines and pushed in 4 L of LR before the fast trip to our ER. The patient went to the ER in about 10 minutes of hitting our doors. He took 35 units of blood that night. The surgery went so long that by the time they had repaired the aorta, removed most of his devascularized stomach and all of his small intestine, his lower legs had clamped off, so he had a BKA on one side and an AKA on the other. After a month in the hospital, having survived all of that plus ARDS, he signed out AMA with intra-abdominal drains still in place to go spend the holidays with GF1 up north. Thankfully, he never returned. Story 33, the bills from my workplace charge people $5 to $5K for a CT scan that takes 10 minutes and costs the hospital like 100 max in costs. The radiologist bills separately, and only like a couple hundred. The CT scanners pay for themselves many years ago, as they scan several dozens daily and rarely ever break. Story 34, throwaway, because I've told this story to everyone I know. Monday was my first shift as a brand new nurse. One of my aides came up to me and said, "Hey, Em is bleeding." I was on my way to the room already, so I regrettably did not ask any questions. I walk in the room, and sure enough, Em has blood on her hand, and she's rolling something between her fingers, things similar to playing the world's smallest violin upon closer inspection. Em has a piece of skin in her hands. I think, oh, maybe she picked a hangnail or a piece of dry skin off her lip or something, no? Em had taken her long, filthy fingernails and pinched off the tip of her. We've been calling it the world's most metal female circumcision. Story 35. This is more terrifying, but a lady who went to organ donation, they took her liver and kidneys, but she didn't die on the table. So they sent her back to me. She just laid there seizing for 40 minutes until she died, with her husband and 3-year-old kid watching. Also had a patient who tried to commit suicide by shooting himself in the face with a shotgun. He also didn't die on impact, but had majority of his face and large chunk of his head missing. Story 36, not a nurse, but my son has had 35 shunt revisions from having hydrocephalus due to being born with spina bifida. When he was 5, I noticed a scab on his head. He was sitting on his toilet chair, and I walked away for 2 seconds to grab something, and when I came back, he handed me the scab. I looked, and a pearl ball was looking back at me. I'm like squinting, and I'm like, that's not his skull arm, that's his shunt. So I calmly called the children's hospital and asked for the neurosurgeon on call. It's a resident. I told him what I saw in him, like it's a shunt. He keeps asking me the color, what it looks like over and over. I'm like, sir, it looks like a pearl bowling ball, but many sure as my kid's shunt burrowed out of his head. That lead to a full shunt replacement after being on EVD drains for 14 days to make sure he didn't get infection. He's 24 now and has had 90 surgeries. I could go on, but that is top 3 of the crazy. I wouldn't have survived him either without amazing nurses and doctors. Residents and fellows, I still sighed and don't take their BS, but I've met more good ones than bad. Story 37, a big thing for me, was during COVID when the morgues were being overfilled. We had 2 staff members essentially on full-time duty, rotating corpses in and out of the fridges we were using because there wasn't enough space to keep everyone stored. You'd stack 2 corpses on top of each other provided they were small enough, and every 30 minutes you'd swap a Gorney out of the fridge. It's one of those things that still pisses me off about COVID deniers. That was during full lockdowns, The idea that people still think the situation was being exaggerated is absurd to me. Story 38, I work in hospital pharmacy. I was on the obstetrics floor delivering meds for a patient when a guy walks by with his very pregnant wife in a hospital gown. Suddenly the guy starts yelling it's coming out. I turn around and the baby had literally fallen out of her vagina. I turned toward the nurse's station yelling for help when one of the nurses just came around the corner, told us to calm down, and just scooped up the baby and led the woman back in her room like nothing happened. Apparently the nurses thought it was hilarious that the large bearded guy from the pharmacy was pale as a ghost and yelling for help. They still tease me. Story 39 warming. This is gross. My mom used to work in a hospital in the late 80s. Said a very pregnant woman came in, puking up green stuff. Guess she had gonorrhea in her throat that she caught from having an affair. Another person I know who worked at a hospital said one time that a baby daddy knocked up two different women around the same time, and they both went into labor at the same time, and he was jumping back and forth between the two rooms. Story 40. I see plenty of but stories, so I will try to add something unique. During COVID, a parent brings in her 5-year-old for breathing problems that have been getting worse over the past few days. Parents tested positive for COVID, as did older sibling. So, without testing him, she assumes the 5-year-old also nebulizer. Being distrusting of hospitals, or likely any sort of medical science in general, she decides to treat him with hydrogen peroxide nebulizers. Yes, hydrogen peroxide. She read it on some Facebook group. Now, at the time, I was pretty okay with the idiots having their fun. You want to refuse the vaccine and double up on the dewormer instead? Have at it. You get the consequences of your decisions. So enjoy. But this was especially infuriating. I legit heard her tell the doc, we just really need to get to the bottom of his breathing problems. Don't worry, lady, we are pretty sure we know what's causing the problem. Story 41, I have a few, but it'll get the collective insanity one out of the way first, having to go from shuffling bodies in and out of the overflowing morgue freezer. Overflow morgue freezer, and overflowing autopsy freezer, so they didn't rot before the funeral homes caught up during the second COVID wave, to dealing with COVID Denny mask morons at the hospital entrance screaming that COVID wasn't real. Back and forth, often within the same 5 minutes. Every shift, those people had lost their minds, and I felt like I was about to two from dealing with them. A patient who had simultaneous medical and psych issues, stripping naked and ripping a Foley catheter. If you're not familiar, they have an inflatable balloon on the end inside the patient's bladder to keep it in place out of his, like he was starting a lawnmower, then standing there screaming with blood streaming out of his penis and pooling under his feet until we got in there and restrained him to a bed. One of my colleagues who went in with me had an armload of towels he was dumping onto the blood so that we didn't slip while wrestling with him. While working in a forensic psych setting, a guy came in who, despite being previously pretty normal, had stabbed his friend's daughter to death with a pair of scissors in the middle of the night. He then proceeded to attack police, attack nurses at the hospital he was brought to for self-inflicted injuries, attack correctional staff at the jail, and attack nurses at the jail before he finally ended up with us. Despite being in a high-security room, he managed to roll up a paper plate from his meal and stick it down his throat to try and asphyxiate himself. We ended up having to do a room entry with a shield to stop the attempt and restrain him. On a couple of occasions, coming across cars that hadn't quite made it to the emergency entrance and having to pull out deathly gray OD victims to Narcan them, or finding GSW victims in the back seat and having to pick them up and run them into a trauma room. Getting a stat call to a locked dementia unit because staff had brought in a cake and 2 large kitchen knives and left them where a surprisingly young dementia patient who was convinced the nurses were going to kill her to steal her organs could find them. She proceeded to chase them around the unit, double knives, and even slashed one of them between the shoulder blades before I got there and managed to get her to put them down. Having a man with severe alcohol withdrawal and a suspected head injury come in incoherent and shaking like a leaf. Even with half a dozen peace officers, EMS, and nurses holding him down, he was still moving too much to get him force started, and the IM meds weren't touching him. I ended up having to lay across his legs while nurses drilled an IO line directly into his shin bone just to be able to meds him properly. I remember laying on his legs, looking up toward his head, and seeing eyes the exact same color as my son's looking back at me, clearly terrified and trying to say something, but too messed up to be able to form coherent words. Having to chase a young woman through the hospital after she came out of anesthesia badly, ripped out her IVs, and ran screaming, naked, and through the hallways until we caught up to her. I could go on. Maybe I should write a book. Story 42 patient came from a prison where he was serving the beginning part of a long sentence for SA to his daughter, and he had ripped one eye out and most of the other because that's where the evil lives. We had to restrain his arms to stop him from finishing the job on his other eye. It was disturbing 12 years later, and it sticks with me. Story 43. This one time, when I was working as a CNA, a DR got two different patients confused. One had severe constipation, and the other did not. He accidentally put in orders for an enema for the wrong patient. I go in there to assist, and as soon as we finished, shot so far out of her that it hit the window on the other side of the room. I'm talking a constant stream with the force of 1,000 suns for about 15 seconds. We had to clear the room and call the cleaning crew to come sanitize, and as they were walking in, a poor man slipped and fell on the floor. I had to excuse myself and laugh for about 10 minutes in the bathroom after that. Not me, my buddy, is a paramedic. Went to pick up the victim of a shooting in a sketchy neighborhood. Dude was in the head, but his cornrows were so tight it deflected the bullet and just grazed his scalp. Dude was seriously lucky that day. Story 44. My sister-in-laws who work as nurses told me of a time a man was rushed into the ER, and when asked what happened, his wife said he wanted to experiment with her, and upon getting an x-ray, the doctor, including my sister-in-law, saw what looked like a cucumber in the guys. How it got all the way up there, I don't even want to know. Story 45. Ventilation unit for the respiratory ward, drawing air from above a drop ceiling covered in asbestos. Maintenance guy taking filter out of said unit, smacking it against a wall to clean it, and putting it back. Storage room for bio-emergency response gear, covered in asbestos. Staff break nap room with a pipe covered in asbestos and a pillow wedged between it and the wall for naps. Story 46. Man vented and dying of COVID. Had multiple chest tubes and vac dressings to try to manage his subcutaneous emphysema. Lung tissue was so damaged that air was just leaking out. Doc was trying to fit another vac dressing on the chest and was having difficulty with something and just stuck his fingers into the incision he made in the man's skin and started tunneling away with his fingers under the man's skin like he was aggressively digging for gold. I swear I saw his knuckles disappear. That's when I decided ICU wasn't for me. Story 47. A woman was pretty against organ donation. Her sister had experienced needing one in her life. The woman who refused gave permissions to her mother as far as what to do in the case of surgery. The woman's sister chased me out, pulled up falsified documents to show she had guardianship over her sister, and tried to change the make all attempt to save woman's life to DNR an organ donor. It was creepy. I waited until she left to notify the woman. Story 48. Not a doctor, but a good few years ago, I was an inpatient for a very painful and heavy period, probably a chemical pregnancy on the first ward I was on. The woman next to me behind my heart, she was 25 with 3 kids. I don't remember what her diagnosis was, but it was something with her uterus. She would be in so much pain that she couldn't get off the sofa, and her 3-year-old would ask if mommy wanted her special tablets. It was that normal for her daughter. She would be admitted every couple of months for pain management and blood transfusion. It was that bad. She told me that she had begged for a complete hysterectomy since the birth of her youngest, the 3 years old, and kept getting denied due to her age. None of her kids were related to her partner. She kept getting denied in case he wanted kids. He had begged the doctors to do the procedure because he wanted her to be happy and healthy. Denied. This woman struggled to look after the kids she had because of what was going on. She had never been able to run around with her 3-year-old, but she might want more someday. It was enough of a reason to leave her in that state. It was crazy. I was transferred to another ward because they needed the bed, so I never did find out what happened to her. I hope they finally listened to her, and she's living her best life now. Story 49. Patient trying to dodge campus police through the surgical waiting room, yelling for someone to call 911, that he was being held against his will, while wearing only boxers, socks, and a towel around his shoulders. One of the police peeps told him, "You're involuntarily committed. You aren't allowed to leave," before they corralled him back to the elevators to the behavioral health unit. Story 50. I work in hospital laboratory. In dispatch, to be specific, a pathologist brings me the actual left leg of a patient who had just passed, as the family wanted it back for the burial. Things should have been in a bucket of formalin. Instead, it's double-bagged in bio bags. So I had to scramble to find a box big enough with a styrofoam insert and pack it on dry ice and drive it to the funeral home. Human legs are insanely heavy. Story 51. Probably this woman who came in for numbness in her foot. I ask about history. She says she broke her leg a week ago. I look for x-rays, and there's none on the system. Turns out she had a displaced tibia fracture, and this woman had pushed it back in and stuck a Band-Aid over THR bit of bone poking out. She needed surgery, and now has constant leg issues. Don't reset your own bones, I swear to God. Story 52. I saw a guy with his wedding band stuck on his manhood once. I only went in to draw blood to check for a clot. But that poor guy was in a lot of pain. I didn't see the resolution, but I heard bolt cutters were involved. Story 53. My first job as a nurse was a med-surg oncology unit. There was an old man who was just skin and bones, whose treatment caused all of his nails to just fall off. Like I would roll him over and just find a pile of nails under him. To help protect his sensitive nail beds, his wife got him these long white cloth gloves. It's been over a decade, so I can't remember the name of the treatment, but what he was getting caused blood to pour from his tear ducts. There was a little blood spotting on the end of the white gloves as well. So imagine this man who was at death's door, blood pouring from his eyes, wearing white cloth gloves. The guy's son thought it would be a good idea to bring his 5-year-old son in to see Grandpa. Guy looked straight out of a horror film, and the kid wriggled from his dad's arms and literally started running, screaming down the hallway. I felt so bad for the old man, who knew exactly how he looked, and I was very angry with the son for coming up with the genius move to show that traumatizing to a child